Welcome to Literacy RX, brought to you by SpeechMED. Hosted by Dr. David Lee Scher, this Literacy RX podcast will facilitate insightful discussions with influential health executives on the newest trends in digital health, the crucial issue of health equity, and the powerful impact of language and literacy on patient outcomes. Subscribe and join us as we delve into exploring how to create healthier and more inclusive communities.
Hi, good afternoon, good evening, and good morning to all our listeners at our podcast, Literacy RX. My name is David Scher. I am the Chief Medical Officer of SpeechMED and the host of this podcast. We're extremely happy and privileged to have Dr. Joseph Kvedar today as our guest. He's professor of dermatology at Harvard Medical School. He's the past chair of the board of the American Telemedicine Association. He's the editor-in-chief of Digital Medicine Journal. He's co-chair of a payment advisory group for the American Medical Association, which has been very involved in obtaining reimbursement codes for telehealth. He's a member of the American Association of Medical College Telehealth Committee, which enables medical schools and residency programs to integrate telehealth into the training of future clinicians. He's the author of two books, one of which is called The Internet of Healthy Things, and the other is The New Mobile Age: How Technology Will Extend the Health Span and Outcome of our lifespan. Welcome, Joe, and it's been a privilege to follow you both directly and indirectly, virtually, throughout the years that telehealth has been evolving along with our careers. You've been involved in digital health, obviously, for many years. Tell us briefly about what led you to and along this journey.
Well, thanks, David. Thanks for having me, and thanks to all the listeners for your time. So I'm a dermatologist by training, trained in the Harvard system, as you alluded to, and stayed on as faculty. And I just had this instinct in the early 1990s. Partly it was because people were talking about new payment models even back then. There was a restlessness in my mind about careers, and I was in the middle of looking at new ways to spend my time, and I bumped into this idea of telemedicine. The way I bumped into it was studying whether a new tool called digital imaging, which is, of course, now ubiquitous in every iPhone and Android phone, but at the time was new, whether that tool could be useful in diagnosing and treating dermatologic illness. And during that time of studying that digital imaging technology, I had an epiphany that if we separated the intellectual input of the clinician from where the patient is, we could do all kinds of interesting things that would broaden access to healthcare, improve quality, improve outcomes, which now all sounds very quaint because it's done every day, but at the time was somewhat ahead of the market. And so I really devoted my career to that. In the next 25 years, I built a team at the Mass General to study this topic, to do clinical validations. We immediately went way beyond dermatology into other chronic illnesses, heart failure, diabetes, hypertension. We ran a second opinion service for patients around the world to get access to Mass General clinicians' expertise. And then increasingly, I've just had the opportunity, as you alluded to take on some national roles, one being with the AMA to create reimbursement codes. You mentioned that's been a very good use of my time, high leverage use of my time. Working with the ATA to move the agenda of telehealth adoption forward has been wonderful. And being an editor-in-chief at Nature's Digital Medicine portfolio has been wonderful as well. So these days I see patients a couple of days a week, and I do those other things and advise a handful of companies, and that more or less keeps me out of trouble.
I'm going to pick your brain here for a second. I am on the advocacy committee about my local HIMSS chapter, and we in Pennsylvania still have not had legislation to address parity of reimbursement of telehealth and live visits, which was seen during the pandemic, but has since gone away. I was wondering what the American Telehealth Association, how they're potentially able to help us, get that done.
Yes, so I'm so glad you brought it up, and we should connect offline about that. We do have a very strong state-based program. I have to confess, I don't know where Pennsylvania falls in terms of the pecking order, but we're working in a number of states. We have a strong advocacy arm now. It's called ATA Action. It's our 501c6, so enables us to do much more advocacy than we could do at the 501c3, which is ATA. So yes, let's connect offline and we can sort through that.
Perfect, thank you. On to the relevancy of what SpeechMED does. How have you encountered issues in health literacy in your own practice? And do you see digital health efforts addressing this really with boots on the ground now? I mean, SpeechMED is really making headway in getting into enterprises. So I'd love for you to address those.
Yeah. So in terms of, I think just to maybe do a little bit of defining, there's health literacy, of course, and then there's digital literacy, and the sort of the way the two collide is sort of how I think about my world. And I think, the thing that comes immediately to mind is that almost every visit these days, whether it be virtual or in person, the last thing I say to the patient is, are you on our patient portal? We call it Patient Gateway. Because we can communicate there. The patients send me, and I have a list of them that I have to deal with when I get off the program with you. Patients send me messages, questions. It's quite amazing how much that opens communication. And so it's a part of my life and their life that is invaluable. But if you don't have the ability to access it, that cuts you off. And I think whether that's a digital literacy problem for some or a health literacy problem for some, I think in my case of my demographic, which skews quite a bit older, it's more often a digital literacy challenge, but could be either. So that's one. I think the other one that comes up, which is not really technology related per se, is when we have language barriers. Now we do have, with technology now, we can bring a interpreter for just about any language into the room using either a mobile device or a telephone. So that's changed in the course of my career dramatically, and that's a good thing. But there's still, I think, some challenges with caring for patients who have a language barrier. And oftentimes I worry that they're not able to process some of the aspects of their care that require them to be literate. And I guess the last thing I'll say is that this is not anyone's newsflash, but the internet has been such a democratizer of how we deal with healthcare. So many patients now come in and they'll say to me, often they often wait for me to tell them what I think is going on, but sometimes not. And they'll say, yes, I looked it up on the internet and I agree with you. And so again, if you don't have access, either digital access, or if you're not able to process that information, I think it puts you at a severe disadvantage.
As someone involved in public health, what do you see as barriers addressing health literacy?
Well, of course, there should be, and there are, I think, some national programs in this regard. There's another, I think, nice phrase that I saw when I was reviewing some literature in preparation for this meeting, that digital health literacy is a super social determinant of health, right? Because it brings so many of the social determinants together. And I know our government has programs to address that. One thing I would say we should push harder on is universal broadband. It's kind of sad when you look at the broad. Another thing that ATA has just done is put out a whole series of maps on the overlap between broadband and health services and income, and showing that people, not surprisingly maybe in a way, but there's a big correlation between low literacy, lack of broadband, and lack of service offerings. So there's a lot of work to be done. Not that necessarily bringing broadband alone in will cure that, but it's a bit of a necessary, if not sufficient, kind of story.
Excellent. And that I'm very glad that you brought to light the digital divide as a source of health literacy or illiteracy. So I appreciate that very much. Anything that you would like to just free-thinkingly discuss about your vision of how telehealth may evolve in the near and distant future?
Yeah, thank you for the podium to talk about that. So one of the things I like to start off with is just level setting with people on where we are in terms of telehealth adoption, and where compared to pre-pandemic, we are approximately 24 or 25-fold more activity than we were then. And that's been quite stable. Of course, there was a blip in the early part of 2020. I'm taking that off because that was just pandemic related. But since early 2021, it's been quite stable. The majority of that activity is behavioral health. And why do I tell that story in answer to your question? It's because the reason behavioral health is so well adopted is that the physical exam, the information that the clinician needs to make a decision on your behalf, can be gotten through a video interview quite well. As you know, as a clinician yourself, there are other instances where you need either physical exam maneuver or something, a little procedure in the office, something that needs to be done. And so what I like to talk about really in terms of the vision future, really it's two things. One of them is ways that we can bring technologies into the home to enhance that video call, whether it be a home testing or whether it be a device that might be in the home that can enable you to do a physical exam for your doctor. There's a device called TytoCare that lets you look in your throat, look in your ears, take your heart rate, take your respiratory rate, etc. It'd be nice to get one of those in every home, right? As like the mercury thermometer that you and I grew up with. So those kinds of technologies to enhance what you can do in the home so that the doctor has more information and can make that virtual call more meaningful for you. That's one trajectory. A second trajectory is using more efficient technologies to make a sort of a holistic digital first experience, so that it isn't that telehealth is this kind of other thing that's out there, but it's integrated, whether it be through asynchronous discussions with your clinician, as I alluded to, over the patient portal, remote patient monitoring, wearables, how all those data streams can influence your care. And then the last thing, of course, that's on everyone's lips is how will we integrate artificial intelligence? And not so much actually, in my opinion, from a diagnostic decision support perspective, but rather from just the usual front-end chatbot perspective. If there's a question that a patient has about their care that can be answered algorithmically, let's get used to having software do that first before they get triaged to a human being. So those are some examples of things that I think are going to take shape over the next 10 years or so. That is, assuming we continue to get robust reimbursement for this activity.
I think that's great. And I look forward to this hospital at home because patients want to be out of the hospital as much as possible. and it's going to certainly relieve the financial burdens, as well as burdens on the shortage of clinicians around, whether they be nurses or physicians. So thank you for that. And I really want to thank you for being part of our podcast today, and want to wish you all the best. And yes, we will be in touch offline to hopefully improve things for telehealth.
Thanks so much, David, and for inviting me. And one of the things that I'll just congratulate you and your team on is that it's short and sweet, which is great for getting more listeners. I think if sometimes they're too long, people don't listen to the full thing. So I look forward to seeing how your podcast gets more traction.
Great. Have a great day.